Welcome to this tutorial on how to insert and remove skin staples. This video will cover the materials you will need, staple insertion, and staple removal. You'll need a skin stapler, a skin pad holder and a skin pad, a staple remover, a scalpel, gloves, and a ruler and marker. Using the ruler, draw a 5 cm straight line on the skin pad. Draw dots at regular intervals along the incision line. Don gloves. Use the scalpel to make a 0.5 cm deep incision along the line. Use your non-dominant hand to bring the wound edges together. Ensure that the two halves of the dots are lined up and that the wound edges are slightly everted. Take the stapler with your dominant hand. Note that most staplers will have an arrow indicating the center of the staple. Beginning at one end, align the arrow on the stapler with the center of the incision. Hold the stapler at a 60-degree angle to the skin. Apply light to moderate pressure and squeeze the trigger to deploy the staple. Do not apply excessive pressure, as this will cause the staple to be inserted too deeply. There should be a 1 to 2 mm space between the staple and the skin. While still holding the trigger down, pull up on the stapler carefully to move the wound edges up. Release the trigger. Check to see that the staple has been properly placed over the incision. If you have misfired the staple, remove it immediately using the staple remover. Repeat the procedure of staples placed at equal intervals until the wound is closed. To remove the staples, position the lower tip of the staple remover under the staple. Close the handle of the staple remover, compressing the staple lightly so that the arms of the staple bend up and out of the skin. Remove the staple.